The World Health Organization has officially declared that the coronavirus is now categorized as a pandemic. The head of WHO office in Samoa, Dr. Rasul Baghirov, said the challenge for Samoa is resources and being able to mobilize if the coronavirus was to become an outbreak here.
We see many patients in a given time. The capacity of the system will be overstretched. And as we know from the epidemic of an outbreak of measles, that required support from outside. And that's why WHO supported bringing 18 medical teams with over 550 personnel, doctors, nurses, and others. And that actually was a big boost to the system. I think that definitely saved some lives and allowed to quickly cope with the outbreak. So whether we can rely on those medical teams to come to Samoa, that really depends on the situation worldwide, in the neighborhood, but also elsewhere, because we are now kind of in the same boat worldwide.
Dr. Rasul said in an event of an outbreak where many patients will need to be admitted, Samoa will require the support from the society, as every countries are in the same boat with the coronavirus.
Highlight one thing importantly, that when the time of challenge comes, the society, observe myself that can stand to it, come together. So I've seen many people coming and offering help during the measles outbreak. And I think that was absolutely important, not only relying on international support, but actually mobilizing resources within society. So I expect that if we will have to face a more serious situation here in Samoa, the country will come to mobilize itself.
Dr. Rasul said there are misinformation online. What is important is that people focus on official fact. He explained that at the moment, 20 labs are working on developing a vaccine for coronavirus. However, this will take some time for an effective vaccine to be developed, trialed, and tested.
Time to time reports that a particular drug or vaccine has been developed and is absolutely effective. We cannot say that with any confidence. As of now, what we know as WHO is that there are more than 20 labs which are developing vaccines. And sometimes we get these reports that there is now one and it will be available in 3 weeks' time. This is not according to our information. We evidence-based organization, science-based. So any trial would need to take time, and it's before it gets approved for clinical use, and probably we are months at best to away from the very with definite answer on the treatment or vaccination.
So is Samoa ready? Is the question that only the Samoa Ministry of Health can answer. As for Dr. Rasul, the head of the World Health Organization here in Samoa, he is simply urging Samoa and the rest of the Pacific to be prepared.
I've seen also some countries which recorded one case many weeks ago, and there was no other case because person who arrived was contained, isolated, and no further cases. So it's very difficult for me to speculate. I think that Pacifica just need to be prepared. Someone need to be prepared. I think this is the best what we can do.
Deidre Fanene for Telefo.